Hi, and welcome to episode 14 of our live series designed to help you take a step towards parenthood. Today, we are discussing one of the leading causes of infertility in women, PCOS. Reports go on to suggest that 1 in 10 Indian women could have PCOS, which also explains perhaps why infertility is on a rise these days in urban cities or even in rural areas. Discussing this with us today is Dr. Rita Bakshi. She is the chairperson of RISA IVF International Fertility Center.
Good morning. Good evening now.
Hello, ma'am. How are you?
Very fine, thank you.
Thank you for joining us today.
My pleasure.
So, ma'am, before we start discussing PCOS and infertility, what I wanted to understand is that what exactly causes PCOS in women?
I would like to really clarify this whole topic and dissect it bear by bear because, one, as you said, it has become very common. 1 in 10 means nearly 10% of the girls are now having PCO. So, polycystic ovary, as it is called, is, you know, that means your ovaries are full of cyst, polycystic. So, instead, what happens normally in every girl, one egg is to develop every month. So many
Hmm.
start developing, but one becomes dominant and rest all become atretic or they fade out. But in women with polycystic ovary, lot of eggs start developing, but not one good egg. So it is like, छप्पर फाड़ के भी मिल रहा है, but still, if you ask, एक अच्छा नहीं मिल रहा. So that is
Hmm.
why infertility is there. So, as you asked me the causes, now hormonal some disturbance in the hormonal axis is the main cause of polycystic ovary. If the way our FSH and LH and estrogen and progesterone have to be there, here the male hormones take precedence, they increase, and that is why you have this kind of disorder as it is called polycystic ovary. So, a lot of cysts in the ovary, and they are, if you look at the ultrasound, you can see them as the pearl string appearance. So you will see like a string, all the eggs are there, and in between there's a thick stroma. So we know that we are dealing with a polycystic ovary.
So, ma'am, when we talk about PCOS, there's also another related term, PCOD. Are they the same? Is there a difference? Are they interchangeable? Can you please shed some light on this?
Yes. So, anybody, especially if it's a young girl, and it is very important not to label anybody polycystic ovary, whether it is syndrome or disease, straight away, because girls will carry this impression that they are polycystic. And I have seen some of the girls are not polycystic at all, but they are always saying, no, no, but I was diagnosed as PCO.
Hmm.
So it is very important not to label them. Why I'm saying, because the axis, the adrenal axis, the our pituitary axis takes time to mature. So unless 2 years have passed after menarche, that means when you start menstruating, 2 years should pass. Only
Hmm.
after that, if you
Hmm.
still see an ovary which has got multiple cysts, otherwise it's called a multifollicular ovary, which is common in every single girl.
Okay.
So many of the girls would go, and then suppose somebody is not well versed in it, then they would just put a scan and say, oh, you are having polycystic ovary, and the girl just carries the impression. Now
Hmm.
let us be very clear, what is the difference between a disease and a syndrome. So
Hmm.
syndrome is of course more serious than the disease. So if it is only ovary, if you just see ovary lined by cysts, then you can say it's a PCOD. But if you have a lot of features along with the adrenal, the testosterone, the high dose of male hormone features along with it, then it is a polycystic ovarian syndrome, because it is then affecting a lot of your other systems as well. And that is the difference between a PCOD, which is simpler, and a
Hmm.
PCOS, which is more, because it becomes a syndrome. That means a lot of more things are affected together. So that is the
So
difference between PCOS, PCOD. Yeah.
so basically PCOD then would be an ovary which has multiple cysts versus like facial hair and other symptoms which we'll talk about when they start appearing, then I guess it's PCOS.
PCOS. Absolutely. Absolutely right.
So could you now tell us about these symptoms, because I know that for a lot of women these symptoms are the basis of diagnosis for PCOS. So
Yes.
if you could tell us about that.
Yes, definitely. So, there are three things which we see. In fact, when a girl walks into my OPD, if she's fat, if she has a lot of hair on her face and her body, and if she's losing hair on her head,
Hmm.
so on one, they have a lot of hair on the body, but the
Hmm.
place where they should have, that is on the head, they are losing. So, alopecia and hirsutism,
Hmm.
and menstrual irregularities.
Hmm.
The moment you see that they have menstrual irregularity. So a mature girl period should be between 21 to 35 days. But
Hmm.
if they are say 60 days or 90 days, so if you are getting your cycle say after every 2 3 months, then you have menstrual issues. One. Secondly, you have whether clinical or biochemical hyperandrogenic features. If I measure your free testosterone, if it is
Hmm.
coming very high, then also I know. But if I can see the clinical features, then also
Hmm.
I know that this is hyperandrogenism. So
Hmm.
menstrual issues, hyperandrogenism, and ultrasound. These three things together give us the diagnosis. It could be two out of three. Not
Hmm.
necessarily all three features have to be there. So if you have menstrual issues and you have clinical or biochemical hirsutism features, then also you are polycystic ovarian syndrome. Or if you have ultrasound and you have menstrual issues, then also. So any two out of the three features is
Hmm.
considered as PCO. The other way I can make out is, all these girls have a lot of acne. Then they have, as I said, hirsutism, alopecia, hair
Hmm.
loss, mood changes, low
Hmm.
self-esteem, depression, sleep apnea, infertility. So, these girls are the girls
Hmm.
who will definitely, because of all these features, not be high on esteem also and be depressed. So these are some of the features I think which make you sure. Weight gain, there may be lean PCO, there can be obese PCO. So not necessarily everybody will be obese, but
Hmm.
we have both kinds. But what
Hmm.
troubles people later in life, probably, so two things I think which trouble everybody. One is a lot of hair, and
Hmm.
secondly is your infertility. So these are the
Okay.
two features which are really troublesome, and
Hmm.
this is what causes them to visit a doctor.
So, ma'am, is it possible for somebody to, let's say, have a regular menstrual cycle, and thus I'm assuming very little or no problem in the ultrasound, but to have all the other physical features of PCOS, which is hair on the face, losing hair on the head, and acne? Is it then also PCOS or no?
No. So, if you have only one feature, that means excessive male hormone, then you also
Hmm.
have to work out whether it is something to do with your adrenals. Because if there are two sources of the male hormone, either it is the ovary or it is the adrenal. So, if it is not ovary, because if it is polycystic ovary, it has to come from the ovary. So, if you have
Hmm.
only, male hormone features, that means you have to work on the adrenal. See whether it is congenital adrenal hyperplasia. So your adrenal itself starts secreting a lot of male hormones, or you could even be having a malignancy or a tumor in the adrenal. So it is very important to differentiate between the two, and the tests that are done are to differentiate between the adrenal and the ovarian, both the factors. So be
Okay.
sure that it is ovarian, and not adrenal.
So, because the reason why I asked this is also because these are the symptoms, right? That a lot of women, lay women who've, let's say, not even go to who've not gone to the doctor, would so go on and say, oh, but maybe I might have PCOS because these symptoms are so
Hmm.
peculiar to this disease. So I'm glad that you brought out that there are
Yeah.
tests to differentiate and that
Yeah.
you should ask your doctor about them.
Absolutely.
Okay.
So as I said, testosterone is one test, but
Hmm.
dehydroepiandrosterone sulfate and other
Hmm.
tests for adrenal are equally important, as well as an ultrasound abdomen, to
Hmm.
look at your adrenals as well as your uterus together.
Okay. All right. So, ma'am, how does PCOS affect fertility in a woman? If you could just sort of help us understand that process a little deeper.
So first, let me tell you that as far as causation is concerned, also that genetics also plays some bit of a role in it. Although we should not blame everything on genetics, but genetics also has a role in it. So if your mom or your sister is also having PCOS, then you know that you may also be one of the person, because they have not been able to differentiate completely, but genetics also has a role. Uh, on an ultrasound, with the finer ultrasound machines that are there, if we see more than 20 follicles in each ovary, you know, so if somebody tells you that you have 4, 5, 7, 8 eggs in one ovary, or you have 20, so the moment you know it is 20, so anything more than 12 and above, we start calling it a polycystic ovary. Thirdly, as I said, the hormonal levels you will anyway do. Now, why it causes infertility? What is fertility? A good egg, a good
Hmm.
sperm together, and a good uterus. Okay.
Yeah.
Now, if I don't have a good egg, or if I'm not ovulating properly, not at the right time. If suppose
Hmm.
your cycles are say 45 days, then you really don't know what is your fertile period. Because fertile period is when it is 15 days before your next cycle. Now, if I don't know when my next cycle is going to be, if it is going to
Yeah.
be 30 days, 45 days, 60 days, 90 days, then I will
Hmm.
miss my fertile window, because I will just not know when is my fertility. So
Yeah.
ovulation or the rupture of egg from the ovary is not proper. It's
Hmm.
disordered. And that
Hmm.
is why a nice good egg is not there for us to
Yeah.
conceive. So ovulation issues are the main issues, as we say, for infertility causes.
So, like you said earlier, कि there are छप्पर फाड़ के eggs, but अच्छा नहीं है कोई, which can
Yeah,
help you sort of conceive.
absolutely, absolutely. So I would also like to tell you that these girls, should go to a doctor
Hmm.
frequently, and
Hmm.
not only have their fertility issues and these look at, because you have thought that these girls are very prone to diabetes. So they
Oh.
should have their diabetes or sugar levels, hemoglobin A1C, as well as their blood sugar checked frequently. That means at least once in a year.
Hmm.
Also, these girls are more prone to high blood pressure. So
Hmm.
they should also have their blood pressure checked, and they should
Hmm.
also have, they are more prone to heart disease. So they should also have the lipid profile.
Hmm.
So I do want these girls to visit a doctor at least
Hmm.
once they are diagnosed, then to
Hmm.
visit a doctor every year, get their height, their weight, their BMI, their waist circumference, because this is where the fat and the lipids and all are going to act, and also get their blood pressure checked, their blood sugar checked, their hemoglobin A1C checked, their cholesterol or the lipid profile checked, and also talk about these girls, because as I said, sleep apnea. So if you are not having a refreshed sleep after you get up in the morning, so that
Hmm.
means, or if you're snoring too much, you know
Hmm.
these are again features of sleep apnea. So during sleep, you're not taking enough oxygen, you're not getting up refreshed, your
Hmm.
mood disorders are going to be there, all because you've not slept well enough. So every time you visit a doctor, you should discuss all this also. So
So
it is
PCOS.
important. Yeah.
Sorry, go on. Go on.
Yeah. So it's also important to know that finally it is not only diabetes, blood pressure, or heart disease, but also endometrial cancer. Now that is another
Oh,
thing. Yeah. So
yeah.
yeah, it's not to scare anybody because it's so common, but it is also, good to know what you are
Hmm.
up to, so that you will take, all the precautions or whatever is you possible to take care.
So then it's not just, because when you look at PCOS, you end up looking at it only from the point of view of acha weight बढ़ गया, or you've got some physical manifestations, or you're having problems conceiving. But the fact that it goes deeper, that there could be diabetes, hypertension, sleep apnea, mood disorders, endometrial cancer, then goes on to say that this is something which needs a deeper look at, and like a proper, like you said, yearly checkups.
Yeah, yeah. So it is very important. And even if infertility is of course one, which we'll of course discuss, but if you get pregnant, then
Hmm.
also again gestational diabetes,
Hmm.
gestational pregnancy induced hypertension, and preterm deliveries and miscarriages are also more common. So it is again important, that we look at, not only infertility, but because it will lead to the pregnancy complications also.
Yeah.
So that is another thing. So now, let's also talk of what exactly can we do about all this, you
Yeah,
know
that was actually my next question. That is there something that you can do to sort of treat it? Are there some lifestyle measures that you can take?
Yeah. Now, first of all, you have to understand that ovary somewhere is overacting. Okay, so one, you have to keep the ovary suppressed. That is
Hmm.
one. Okay, how can we do that? That is by giving oral contraceptive pills, because the oral contraceptive pills cause suppression of the ovarian, of the eggs to come out. Otherwise, in having baby, but in adolescence, where when you are so much features are coming, you want to suppress the ovary. There's no other way but to give them some hormones, that is the combined oral contraceptive pills, which keeps the level down. So that means not even one egg will come up. Okay,
Hmm.
the when where so no egg is going to come up, and
Hmm.
that will keep the ovary suppressed. Secondly, these are also insulin resistance is there. That's why
Yeah.
you have diabetes. And you
Hmm.
all these, you can see these girls will have very dark underarms. They will have on the neck, you'll see black lines, and you will see some wart like acanthosis nigricans are those lines that you see, the dark lines on the neck, and you will see some kind of warty features also on the neck. All this, just by looking at it, you can say she has insulin resistance. So she
Hmm.
requires insulin sensitizers. That
Hmm.
means you have to take, your body requires your cells to become sensitive to insulin, because there's
Hmm.
so much resistance to it. So these are
Hmm.
the people who require a medicine, which is metformin.
Yeah.
That's one medicine which is commonly given to most of these girls who are having, so it is an insulin sensitizer. And let me tell you the dose. I've seen a lot of girls come up with a dose of just 500 milligram once a day. It doesn't work. It just doesn't work. You have to have minimum 1500 to 2500. So, either 500 three times a day, or 500 in the morning, or 1000 at night, because that is the dose on which it will work. Sometimes girls have been taking 500 OD, and they think, okay, once a day is enough. But no, it's not. So proper dosing
Yeah.
is important. Of course, we have to keep looking at the liver in between. The liver function tests have to be done, just to be sure that the drug is not causing any damage. So one thing I told you was birth
Hmm.
control pills, the oral contraceptive pills.
Yeah.
Second are the insulin sensitizing agents like metformin. And of
Hmm.
course, what goes without saying is weight loss. So there are no two things on. We understand
Yeah.
this is a disease which is not just going to vanish in a day. Okay, it is a disorder which is there, and much as you think it'll get cured with Ayurveda or homeopathy or whatever, it doesn't. Okay, so all you have to do is you have to maintain a good lifestyle, and that means
Hmm.
10% of the weight loss. So be sure that you don't get overweight. One, and if
Hmm.
you're trying to conceive, then I would say, if you, the moment you or your menstrual cycles are irregular, then lose weight. Once you lose weight, and 10% of the weight loss bring about a big change in your ovaries, in the way your hormones work. Well, there was a time when we were doing a lot of laparoscopic ovarian drilling. So we would look
Oh.
at the ovary, we'll make holes in the
Yeah.
ovary, and so that the eggs just come out, and then those holes are there. But
Hmm.
this is a surgery which is not done frequently now at all, unless you put in a scope for some other reason, and you
Hmm.
find your large cysts on the ovary. Then maybe just few of, you just puncture few of them, because that will decrease your male hormone. But
Hmm.
more or less, we have come on that, if we have a lifestyle in which we have a low glycemic diet, low carbohydrate diet, high protein diet, so diet and weight loss two
Hmm.
things together will do wonders, and exercise. So
Hmm.
let me
Okay.
just have a word on the exercise also, whether it is mild, it's moderate or severe. But exercise at least 5 times in a week, at
Hmm.
least 45 minutes of exercise every single day. It's not even five. Now our guidelines are saying 7 days a week. So no rest in between, 7 days, 45 minutes of exercise. Whether you can do, mild like walking and or moderate, when you can do some jumping and aerobic exercises, or you can do some severe exercises like, when you're out of breath and you just can't talk and your heart is pounding.
Yeah.
So any of the exercises that you choose to take it, but exercise is very, very important. So diet, one,
Hmm.
and exercise, another. Two very, very important things.
So,
This
ma'am,
goes without.
you just spoke about how there are these two medicines which in combination can help you control your PCS, of course, upon the recommendation of your doctor, never on your own. And how weight loss and a healthy lifestyle is also important. There is also this belief that if you lose weight, if you get your lifestyle in order, you can reverse PCOS and be completely without medicines. Is that true?
I would say whether it is diabetes or it is hypertension or it is thyroid or PCOS, all these diseases, you can just keep them in check. If I say we can reverse,
Hmm.
no, that's not the
Hmm.
truth. But as long as you maintain a good lifestyle, this will
Hmm.
be in check. And I think that's what you want finally. You want
Yeah.
things to be in check so that they don't manifest and they don't trouble you. So I, especially for people who are trying fertility, in them I would say please consult a doctor or a fertility specialist, especially so that they start you on some ovulation induction drugs,
Hmm.
because it is important to take help. Sometimes I'm seeing these girls take 10, 15 years, suddenly 35 साल में they will come up and they will say अरे बच्चा नहीं हो रहा, and then I will say where were you, what were you doing, you knew you have. So then they will say अच्छा हमने सोचा ऑटोमेटिक हो जाएगा. तो
Hmm.
अगर 1 साल हो गया है and you've
Hmm.
not 12 months of, yeah, you've been together 12 months and you are young. If it is you're more than 35, then I won't even say 12 months, 6 months. 12 महीने हो गए हैं किसी को भी, they have been together, they've not conceived, it's a time to visit a doctor and see. Now fertility ovulation induction is important, and that is simple tablets है, कोई ऐसा बड़ी चीज नहीं है. Nowadays पहले clomiphene was a very popular drug. Now all our European guidelines have come out with letrozole, which is a drug which is accepted. So 5 दिन दवाई खानी है, and then maybe you can have a follicular monitoring, just see कि eggs are coming up well, right time when the eggs are ready, then all you have
Hmm.
to do is take a injection rupture and be together, or go through the next process. I would also take, Meghna, this opportunity to speak about IUI and IVF, because
Okay.
बहुत बहुत बार ऐसा होता है कि लोग, ये जो मैं ओव्यूलेशन इंडक्शन की बात कर रही हूँ और जो गोलियां खाने की बात कर रही हूँ, काफी लोगों को मालूम पड़ जाता है जब वो 1-2 महीना ऐसा करते हैं, तो फिर वो अपने आप ही लेते रहते हैं. दे डोंट इवन गो टू अ डॉक्टर. तो इट इज इम्पोर्टेंट कि आप ऐसा भी ना करें. और हम लोग कहते हैं कि 3 महीने, अगर 3 से 6, मैक्सिमम 6 बार आपने दवाई खा ली और आपको अगर बच्चा नहीं हुआ है, गो है गेट चेक. हो सकता है आपकी ट्यूब बंद हो सकता है कोई और प्रॉब्लम भी हो साथ में, हम अभी इसी की
Hmm.
तरफ ध्यान दे रहे हैं. तो इट इज
हाँ.
इम्पोर्टेंट कि आप ऐसा ना करो कि दवाइयां खाते ही रहो.
Hmm.
इट्स वेरी कॉमन. मेघना, आई कांट टेल यू कितना कॉमन है ये बात कि लोग सालों सालों, दे आर इयर्स दैट दे हैव बीन टेकिंग, और बोल रहे हैं अरे हमने को सोचा 5 दिन की गोली है खाई और हो जाएगा, हमने और कोशिश. नो, दैट्स नॉट राइट. सो यू आर
Yeah.
डिप्लीटिंग योर ओवरीज ऑफ एग्स. हाँ, तो इट इज इम्पोर्टेंट कि हम पहले ओव्यूलेशन इंडक्शन प्रॉपर कराएं किसी डॉक्टर के पास जाके. एंड अगर नहीं है, और आपने आईयूआई, मतलब जो नेक्स्ट स्टेप होता है कि इंट्रा यूट्राइन इंसेमिनेशन, आपने आईयूआई करा के देखा, मतलब आपके हस्बैंड का स्पर्म वॉश करके अंदर डाला, फिर भी अगर नहीं हुआ, तो 3 या 4 साइकिल के बाद आप आईवीएफ की तरफ जाएं, यानी कि इन विट्रो फर्टिलाइजेशन. और इन लोगों के लिए मैं, बिफोर इवन आईवीएफ, दे हैव वी हैव समथिंग कॉल्ड आईवीएम, which is only for
IVF.
PCOS. मतलब
Oh.
IVM, that is in vitro maturation. तो इसमें
Hmm.
क्या करते हैं कि आपके एग्स शुरू में ही निकाल लिए और उनको बाहर मेच्योर करा हमने, मतलब ऐसे हार्मोन्स हमने बाहर डाले, वो एग्स रेडी हो गए, 36 आवर्स में दे बिकम लाइक बिग एग्स, एंड देन वी
Hmm.
कैन फर्टिलाइज विद योर husband sample, make good babies, and then put inside you. So that is another way to go about IVM, or in vitro maturation of eggs
Hmm.
as it is called.
Hmm.
Otherwise IVF जो प्रोसीजर है, मैं अगेन आपके माध्यम से मैं ये भी बताना चाहूंगी लोगों को, इट्स अ सिंपल प्रोसीजर, कोई ऐसा
Hmm.
दर्द नहीं है। बहुत
Hmm.
मिथ्स हैं लोगों को कि एक तो वो बहुत दर्द है इसमें, और सेकेंडली बहुत आराम करना पड़ता है।
Hmm.
Gone are those days, मेघना, जब इसमें लेटना पड़ता हो and you to pass urine and stool on your bed. No, now it is, आप आए, आपने कराया और आप घर गए and you're back to work. So rest is
Life
gone.
goes on as normal.
Secondly, एब्सोल्युटली लाइक नॉर्मल। और जो दूसरी चीज है वो है इंजेक्शंस, जो दर्द है वो इंजेक्शन जरूर है, आई एग्री विद दैट कि 10-12 दिन के इंजेक्शन जरूर हैं, बट दे आर लाइक द जो डायबिटिक इंसुलिन लगाते हैं अपना खाने से
Hmm.
पहले, हर आदमी तो 3 बार दिन में लगाता है, ये आपको एक बार अगर 8-10 दिन लगा भी लिया तो आई डोंट थिंक इट्स अ पेनफुल प्रोसीजर एट ऑल। सो दैट इज समथिंग, सो ऐसे लोगों को हो सकता है आईवीएफ की जरूरत पड़े। अगर आईवीएफ
Hmm.
की जरूरत पड़ती है तो व्हाट इज इम्पोर्टेंट इज दैट दे कैन समटाइम्स लीड टू हाइपर स्टिमुलेशन। दैट मीन ओवरी इतनी स्टिमुलेट हो गई कि फ्लूइड आ गया आपके पेट में, आपके बाकी बॉडी में, और उसके तरफ हमको ध्यान रखना पड़ता है। सो एवरी गुड डॉक्टर नोज कि जब हम इनको स्टिमुलेट कर रहे हैं तो ये एक चांस है कि इनकी ओवरीज हाइपर स्टिमुलेट हो जाएंगी, तो उसका उसकी तरफ पूरा ध्यान रखा जाता है, मतलब इनके एग्स को, एम्ब्रियोज को फ्रीज करा जाता है। नॉर्मली उस साइकिल में ट्रांसफर नहीं करते हैं, तो हमने
Hmm.
इस साइकिल में एग्स निकाले, बेबी बनाया और उनको फ्रीज कर दिया। अगले साइकिल में जब इनकी ओवरीज शांत हो गई बिल्कुल, देन वी
Hmm.
जस्ट लुक एट द यूट्रस एंड उसके अंदर हम डाल देते हैं। सो दिस इज हाउ दिस होल प्रोसीजर ऑफ IVF and
Hmm.
fertility. But so I think I've explained a lot in detail, Meghna.
Yeah.
Anything that's on your mind, please shoot. Yeah.
So I'm we're glad that we're talking about this because, like you said, even with the PCOS, since it's so common, we all mostly know somebody or the other, right? And then you get one dose of medication. Doctor said come back after 2 months. You don't go. You keep having that medication. And similarly, like you said, when it comes to assisted fertility, assisted reproductive techniques, and I'm glad we're talking about it. That it's wrong to sort of keep taking the medicines without seeking a consultation again, just thinking, oh, ye dawai se to ho hi jayega, whatever your problem is, because it could lead to bigger problems as well, right? I mean,
Yeah,
and not solve
absolutely.
your fertility issues.
एब्सोल्युटली। सो आई थिंक अगर इतना भी लोगों को समझ में आ जाए, नॉट दैट कि अपने आप दवाई लेना एक हद तक तो ठीक है, बट उसको कंटिन्यू ही करते चलेंगे, तो दैट इज नॉट अ राइट थिंग। बड़ा सिंपल सा एक टेस्ट होता है AMH, दैट एंटी
Hmm.
मुलेरियन हार्मोन।
Yeah.
इफ ऑल द गर्ल्स कैन गेट दैट टेस्ट डन, दे वुड नो वेयर दे आर। अगर 3.5, 1 to 3.5 तक नॉर्मल होता है, अगर 3.5 से सपोज 7 है, 8 है, 9 है, 10 है, देन दिस इज अनदर टेस्ट टू ऑल्सो शो दैट यू मे बी पॉलिसिस्टिक ओवरी। तो अगर आपको डॉक्टर के पास भी नहीं जाना तो आप एक ब्लड टेस्ट करा लो, दैट इज सीरम AMH, एंड यू वुड नो whether
Hmm.
you are polycystic ovary disease or not. So I
I
think
finally
that
get to
makes
know once and for all.
yeah. So yeah, मैंने पता क्या देखा उस दिन, I saw a girl, she walked in with her AMH was 1.5 and she kept saying मेरे को PCO है, PCO है। ऐसे तुम्हारा AMH तो lower side पे है, it is not on
Hmm.
the higher side. So it's
Hmm.
only when it is more than 3.5, 5.5, 7.5, then only you are PCO, you're not a PCO at all. But उसके दिमाग में इतना घूम रहा था कि उसको बचपन में किसी ने बोल दिया, उसके मेंसेस 2-3 महीना आगे पीछे हो गए होंगे, सो somebody said नहीं PCO है। एंड एडोलेसेंस में जो ये हेयर वेयर वाली प्रॉब्लम है, normally
Hmm.
also a little bit
Yeah.
of all this is there when when you go for threading and all that, so
Hmm.
people assume कि मेरे को तो PCO है ही है। So I think it is very important इसलिए कि
Yeah.
डॉक्टर के पास जाके राइट डायग्नोसिस बनाए, and only then we classify ourselves as
Dr. Bakshi, also PCOS is, I generally, talking from personal experience, PCOS is also misdiagnosed because See, think of it. When you're not married, when you're younger and you have problems like acne and facial hair and hair loss, you don't think of going to a gynecologist because your periods might just, be normal at the moment. Maybe
Normal.
it's 40 days apart. You go to a dermatologist. At times, you're even
Mhm.
diagnosed there. At times, you're diagnosed at your general physician. So
Mhm.
there's this whole thing of I feel in India that where we're also not consciously going to a gynecologist because you only go to a gynecologist when you want to get
When you're
pregnant.
married. Yes.
Yeah, when
I,
you're
I agree
married.
with you, yeah, I agree with you, Meghna. So the good part is that the dermatologists have also become wiser, and they would, because that's the first thing that they would see, beside the laser and the epilation and the other creams and, that they would give them, they would also say कि एक बार PCO rule out करा कराओ. So, they
Hmm.
would refer them back to us for us to diagnose whether PCO is there, so which is a good part. And as
Yeah,
long as लोगों को खुद ही पता चल जाएगा, so they would probably first go to a gynecologist, get
yeah,
the treatment, make their ovaries quiescent, lose out
hmm.
on all the androgenic features which are there. Then maybe if they require, of course, sometimes they would still require
Okay.
the help of a dermatologist. Finally, of course, those hairs which are already there, you
Hmm.
definitely, you can prevent the growth of newer hair, but the hairs which are already there will definitely require. I've seen some of them shaving or using creams or whatever.
Waxing.
But
Yeah, yeah. So, ma'am, when it comes to PCOS, what are some of the self-care methods that you suggest to women?
so, as I said, I think it is very important to, you and I can maybe skip exercise once in a while, but these are
Hmm.
the people, they have to learn, one, not to eat junk food, not to be on the white maida and on a diet which is full of carbohydrates, because you understand that this is a diabetic kind of a condition.
Yeah.
So, low carb diet has to be there, lot of vegetable, fruits, nuts, eggs in their diet that would help them. And they cannot do without exercise also. And also they will have to keep their weight in check. I think the
Hmm.
most important thing will be to keep their weight in check. So they have to, they don't have a choice, let me say. I think they, and also of course to keep stress away. Well, that's
Hmm.
very general. That's general for every single person. But in these people, it is important that yes, and don't be shy of taking the tablets. I think a lot of people, I've seen a lot of mothers, they wouldn't want their girls to be on and say no no nahi se high wo height ruk jayegi. I say
Hmm.
it's very bad, इससे ये कभी conceive ही नहीं होगा. So
Yeah.
let me tell you that oral contraceptive pills are they act only in that cycle. And the moment they want a baby, whenever, I mean, they decide to do that, they if they leave it for 2 or 3 months, their cycle bounce back to normal. So they don't have to look at this. So some girls have very little flow, some girls have overflow after 3 months. So these are the kind of features which are there. So I don't want them to be so troubled with cycles and destroy their life. It is
Hmm.
better to be on this controlling pills which will control your cycle. Also on the insulin sensitizer, as I said, metformin and myoinositol. There are other drugs which are there. So let the girls be there. This will not only keep the insulin in check, but also help a little bit on the weight loss also.
And also, birth control pills or rather oral contraceptive pills come with that stigma in India, right? That you are only
Yes.
supposed to take them when you're sexually active. And how
Yes.
can we give our unmarried young girls these pills? So,
Yes.
very few people actually realize that it's perhaps the first line of treatment in PCOS.
Absolutely, yeah. So I always tell mothers who come with the young girls,
Hmm.
and they would always say कि अरे आप तो there are Meghna, to be truthful, बहुत शादीशुदा लोग भी are especially in the beginning of their married life, when I tell them कि आप थोड़े महीने, if you're trying not to conceive, is one of the best methods. But they
Yeah.
would say नहीं नहीं, अगर एक बार गोलियां खा ली फिर हमें बच्चा ही नहीं होगा कभी. So I said देखो अब ये तो अभी टेस्ट करा नहीं है हम लोगों ने, होगा कि नहीं होगा, everybody is good guess. But if you imagine, so everybody blames the tablets for all that. So I always
Yeah.
tell them, कि, भाई, if there is, these are very short acting. and it's only
Mm.
for a very short period of time that you're giving. So it's okay,
Mm.
manage your life better. So why have failures? uh, you know uh,
Absolutely.
of the other methods that they use, also it is important that you use nearly fail proof methods, and this method is definitely 99.9% effective, so at least for those people. So right now, of
Mm.
course, we're talking about PCOS, but I think everybody who's hearing should also know a little bit about contraception for somebody
Yeah.
who requires. So mothers, don't be scared if your
Mm.
daughter requires these pills. So once they have attained menarche and they've attained their height, it's okay to for them to go on these pills, and let them be on pills and be comfortable.
So, ma'am, before we call it a day, what would be your final advice to women with PCOS who are trying to conceive?
So, as I said, I understand that there is an issue, and they should also know that if they have not conceived within a year, there is an issue. They should visit a right person. One. Secondly, take the pills according to the way doctor gives you. Go for the follicular monitoring. It's not लेली गोली और पता नहीं हमारा एक बन भी रहा है कि नहीं. So be in contact with a doctor. Get your follicular monitoring done by an ultrasound, and then exercise, weight loss without saying. I've seen people who are 140, 150 kgs become pregnant by losing 10, 15 kgs. So I personally know of
Wow.
many people who have lost just 10, 15% of their weight and have got naturally pregnant. So it is very important to look at weight loss, exercise, right medication, and visit a doctor and be under a doctor.
Thank you so much, Dr. Bakshi. It was really so insightful because you've discussed so many things that we don't normally talk about when it comes to PCOS. Thank you for giving us your time today. I hope you have a nice day.
Thank you. Thank you. Thank you so much.